Hello, my name is Alan Vainrib. I'm coming to you from NYU Langone Health, and today I'll be talking with you about modern mitral regurgitation evaluation and treatment using 3D transesophageal echocardiography, or TEE. So I'll start off with a case presentation. We have a 67-year-old male with congestive heart failure symptoms. He has a past medical history of 3-vessel coronary artery disease. He's had a prior myocardial infarction and severe ischemic cardiomyopathy. On previous transthoracic echocardiography, he was found to have significant mitral regurgitation, and he was referred to our clinic for a transesophageal echocardiogram. So we begin our transesophageal echocardiogram with 2D images, and this is the mid-esophageal 4-chamber view. You can see a few things that are notable on this image. One is the left ventricle has severe systolic dysfunction. The other is the mitral valve appears tented with normal leaflet thickness and morphology. On 3D, we get even more information, and in one acquisition, we can acquire the entire heart. And using sophisticated technology that tracks the endocardial borders, we automatically get the left ventricular volumes. And that allows us to calculate the end diastolic volume, end systolic volume, stroke volume, and the ejection fraction. And in this case, very clearly, his ejection fraction is severely reduced at 28%. The next step on this transesophageal echocardiogram is evaluation of the mitral valve. And we begin with a 3D zoom image of the mitral valve in the standard so-called surgeon's view. And what you see here is the mitral valve in the center, the aortic valve on the top of the image, the left atrial appendage on the left, and the interatrial septum on the right. And one notable feature here that we can see very nicely on 3D TEE is the coaptation point of the mitral valve is deeper into the image than you would typically see. And this is very characteristic of this type of mitral regurgitation, functional mitral regurgitation, which involves normal leaflet morphology without prolapse or flail, but a malcoaptation in the center of the leaflets. When you add color Doppler, you can see very clearly there's severe mitral regurgitation. But we don't get a clear sense in this image of exactly the origin. So one technique that we can use is tilting down the image, and that allows us to see the extent of the mitral regurgitation. And in this case, we can see that it originates in the center of the valve, or the A2-P2 portion, and extends medially, which is very characteristic of this type of mitral regurgitation. In this image, we see a simultaneous left atrial and left ventricular view of the mitral valve, which is a unique way to visualize where the coaptation point of the mitral valve occurs. And in this case, you can see that it's deeper than it would normally be due to tenting of the mitral valve leaflets. In addition, on the top portions of the screen, you can see and compare to the 2-dimensional images, which also show that tethering. The next step of the evaluation is to perform quantification of mitral regurgitation. And we use the 2017 American Society of Echocardiography guidelines to help us identify the various parameters that are useful in measuring the degree of mitral regurgitation. And on the bottom portion of the screen here, you can see we use the effective regurgitant orifice area, regurgitant volume, and regurgitant fraction to help us go beyond simply our eyeball method of quantifying mitral regurgitation based on color Doppler, but to take it to the next step and use guideline-directed, validated techniques for assessment of the degree of mitral regurgitation. So traditionally, using 2D, the proximal isovelocity area, or PISA method, takes a two-dimensional image and measures the degree of mitral regurgitation using a combination of a color Doppler and a spectral Doppler technique. This method assumes a hemispherical shape of the proximal isovelocity area. We know in functional mitral regurgitation, this is not often the case. And we can use three-dimensional echocardiography to help us get more true PISA measurement. So here we have 3D proximal isovelocity area, or 3D PISA. And you can see here on the right image that the shape of the PISA is hemi-elliptical rather than hemispherical. And we can measure the actual volume of the PISA and combine that with our previous spectral Doppler measurements. And you can see that the effective regurgitant orifice area is 0.4, which is in the severe range. Another technique is the vena contracta area, which, as you can see here, uses 3D multiplanar reconstruction to pinpoint and measure the exact area of the regurgitant orifice. And this is synonymous with effective regurgitant orifice. And you can see here, it's the exact same number, 0.4. A new novel technique is 3D color with easy flow. And this allows us to use 3D color to measure the flow across the mitral valve and compare that to the flow across the left ventricular outflow tract. And this comparison gives us regurgitant volume and regurgitant fraction. This novel technique is extremely useful in cases where 3D vena contracta area, or 3D PISA, are not possible. You can see on 3D color with easy flow, two discs. One disc is across the mitral valve, and the other is across the left ventricular outflow tract. From this, we get the regurgitant volume and the regurgitant fraction. And this is an exciting new technique for measuring the degree of mitral regurgitation. The next step of our transesophageal echocardiogram is assessment for percutaneous therapies. On one hand, we can do transcatheter mitral valve replacement, and on the other, we can do transcatheter mitral valve using a mitral clip. For transcatheter mitral valve replacement, the key measurement is the mitral annular dimension, and this allows us to size appropriately transcatheter mitral valves. If the size of the mitral annulus is too large, they may not be a candidate for this therapy. So it's very important to measure this accurately. And in addition, there are a number of different sizes of transcatheter mitral valves, and the appropriate size is measured this way, in addition to cardiac computed tomography, or CT. We can use 3D multiplanar reconstruction to help us measure the mitral annulus. And you can see here on the right side, we measure the anterior-posterior diameter of the mitral valve and the commissure to commissure point. However, we can also use easy valves, which is a novel technology using machine learning-based techniques to automatically measure the mitral annulus. And this makes it a lot easier and potentially more reliable method for measuring the mitral annulus. And you can see here, we are able to get the same exact measurement of AP diameter and commissure to commissure, or anterolateral to posterior medial diameter, using easy valves. Also, easy valves allows us to model the mitral valve dynamically. And in this case of functional mitral regurgitation, as you can see on the left, we can apply our model to the right and superimpose the color to demonstrate the location of mitral regurgitation, as well as to measure various parameters. And in this case, we're measuring the tenting height of the mitral valve along various points of the coaptation line. Easy valves can also be used for other types of mitral regurgitation, and in this case, this is degenerative mitral regurgitation. On the left hand, you see prolapse of the P2 scallop of the posterior leaflet with a flail segment. On the right side, you see the model, very nicely demonstrating the severe amount of prolapse in red, as well as capturing the flail segment. For MitraClip, the focus is somewhat different, and it's very important to measure the mitral valve area prior to going into the procedure, as the MitraClip itself has a risk of giving a patient mitral stenosis. So one method is to use 3D and en face measurement here, where a tracing is made along the mitral valve orifice, and subsequently the mitral valve area is obtained. This method can be inaccurate, as where you're tracing in a three-dimensional space can sometimes be ambiguous, and therefore it's more accurate to use 3D multiplanar reconstruction, as we've done for other methods, to measure the mitral valve area. This allows us to be at the mitral valve tips and know exactly the accurate mitral valve area. Another method is to use easy valves, which allows us to also automatically measure the mitral valve area. And you can see here that the mitral valve area is 6.6 centimeters squared on this measurement. This particular patient underwent MitraClip, and you can see here a 3D echocardiogram image of the mitral valve in the surgeon's view as the mitral clip is being positioned. This is extremely useful and can only be done using 3D echocardiography, which allows the interventionalist to know the exact not only position of the mitral valve prior to placement, but also the correct orientation of the mitral valve. And here you can see that the mitral clip is perfectly oriented at A2, P2, and we are ready to go into the ventricle. MitraClip has now been delivered, and you can see the placement of the MitraClip, which is somewhat on the medial side, targeting specifically a more medial type functional mitral regurgitation. And you can see here, using our dual LA and LV view, that the MitraClip is very nicely stable, and we've created a double orifice mitral valve. And as you can see here, after the MitraClip is delivered, there's almost complete resolution of the mitral regurgitation, leaving only trace MR. So the next step in the evaluation is to assess the residual mitral valve area. And we can do this using multiplanar reconstruction, as you see in this image. However, it's very important to measure the two mitral valve orifices separately, as that is the most accurate way to assess the degree of mitral stenosis after a MitraClip. So in this case, you can see we're measuring the larger mitral valve orifice first, and then we subsequently measure the smaller mitral valve orifice. This can also be done using easy valves and creating a 3D model of the mitral valve, and you can see the mitral valve, two orifices, and subsequently the mitral valve area. In summary, 3D TE is critical in both the evaluation and treatment of mitral regurgitation. In addition to 3D vena contracta area, 3D easy PISA and easy flow are novel methods for MR quantification. Easy valves can help you accurately assess the size of not only the mitral annulus, but also the mitral valve area, which are critical in the assessment of percutaneous therapies for mitral regurgitation. I hope this educational video has been instructive. The assessment of mitral regurgitation is so important. There are so many new methods that are available that go beyond the simple eyeball method that allow us to more accurately assess mitral regurgitation. And this is going to be so crucial for future percutaneous therapies as they increase in volume across the world.